What is rehab or rehabilitation? My name is Fred Begaris, a board-certified sports and spine medicine physician in Virginia Beach, Virginia. After 10 years of practice, I still find musculoskeletal medicine both fascinating and challenging. This podcast is about the lingering thoughts and questions I've had after residency and fellowship. My hope is to spark discussion, challenge dogma, and share my experiences in musculoskeletal medicine. Welcome to the Talking Rehab Podcast. The concept of the road back. When I talk with patients, I like to explain this concept of the road back after an injury, trying to get back to our previous level of activity. What I've learned is with time, the road back is typically a path you have never taken. When we're 18, 19 years old, we get an ankle sprain, we bounce back next day. This does not mean that we have healed completely, rechained all the things that need to be worked on. We don't necessarily have to check all of the rehab boxes. What are these rehab boxes? Tendon training, muscle training, endurance, tolerance, mobility, time, range of motion, skill-specific training, time for adaptation. But when you're young and healthy, you don't have to check any of these boxes in order to continue playing or getting back into the game. Now, the older that we get, or the more times we get injured, the road back eventually starts to get a little bit slower or requires more effort than it used to. Many patients conclude it's just because we're quote-unquote old or the joints are damaged beyond repair, things like that. It presents a problem sometimes, particularly in the older patient. So as we get older, I find that we have to actually address these rehabilitation boxes. However, checking off these boxes can take more time. The biggest problem that brings people in is about pain. Pain is a symptom of something. Naturally, if the pain goes away, they can get back to their previous level of activity, just like they did when they were 19 or 20 years old. So people often seek these type of treatments that just get them back. However, pain lingers the older that we get. It doesn't necessarily have to be sharper or more painful, but it just does. Plus, it becomes more disabling, much like an ankle sprain that usually takes 2 to 6 weeks, even in the most mild cases. When you are in your 50s or 60s, it can take months to even a year to completely recover. Sometimes it's not just necessarily normal again. You're functional, but it just doesn't really feel the same. Sometimes there's persistent pain. So you're limping and things like that. So the road back is often at a road that you've actually taken before. You now have to work on checking all those boxes. Again, mobility, strength, proprioception, things like that. But in addition to that, you have secondary challenges. We have other areas that don't compensate as well as they used to. Someone sprains their ankle, they tend to limp. They offload the injured side with the other leg, and the 4 to 6 weeks goes by. Ankle sprain heals, no problem. Now take into account arthritis. Arthritis is normal. It's a normal process, just part of being alive. There are various factors that contribute to how you develop it. Some of them you can control, and the others you can't. It's just a fact of life that everyone has to juggle. When you sprain your ankle and you're 60 years old, you try to compensate using the other leg, which has developed arthritis in it. Doesn't necessarily mean that you have knee pain, but you can imagine you're now putting extra pressure on a joint that has less cartilage in order to offload the painful ankle sprain. So you'll naturally start to see people develop pain on the other side. The person has now developed 2 separate problems. One more painful than the other, but it is also now slowing them down. Now you have to try and check those boxes. Work on all the factors that you can control. But it's now hard to do those exercises because the knee now hurts in addition to the ankle. So again, you have to factor that into the overall equation. The reason I'm bringing this up is that it's not only a point of pain, it's also a significant component of frustration. I find a lot of people come to me looking for the shortcut. Like, how do we get this thing back better, faster, with the least amount of effort? That obviously makes sense. Who wouldn't want that? Unfortunately, that's just not how the body works. Or at least that's not the way it works anymore when you are in your 20s, 30s, or 40s. The body just simply doesn't feel or heal the same compared to when you did in your younger years. It doesn't necessarily mean that you're old, but it does require you to actually have to learn things. When you're younger, you don't have to do these things because you tended to bounce back without any effort. But when you stop bouncing back, what's your game plan? Believe it or not, I get a tremendous amount of resistance from patients, even about having this simple conversation. Again, that's not something people are willing to do the older that we get. We tend to be set in our ways. We have our own habits. We have our own lives. And learning new things doesn't fit into that picture easily. They're not excited to learn anything new, especially when all that they can focus on is the pain. I find another strategy that people will implement is waiting for the pain to get better before they start learning anything new. This is a very bad strategy. Waiting longer almost always brings on a second, a third, a fourth problem. There are consequences to waiting if your only plan is to be sedentary. Time does heal most things. Resting is important, but you still have to retrain the healed structure. Retraining is a new road and not one that led you there. It's a point that nobody likes to face, but it is my job to help lay it out there, to not necessarily tell people that this is the end of the road, but define what their road looks like. That way, my patients know that they are actually getting better. They understand markers of progress, and they also have someone to help interpret what they're experiencing, both good and bad. I can go on and on about this, but I just thought about this today. I think it's important not only for patients to appreciate this, but also clinicians, physicians, physical therapists, athletic trainers, anybody who is listening to this talk. I think it's a good way to frame this very difficult discussion. The way we currently talk about it is very vague. It's just going to get better, give it time. In my opinion, that's not really an answer, and rarely does it actually put people at ease. Telling people that the way that this goes is that you have to manage the pain while checking off these boxes and being very specific about it. People don't necessarily have to like this approach, but I see people not only after the pain is gone, I see them long term. That is the job I like to do for my patients. I follow them out long term, so I know that this method actually works. People are human. No one likes to learn new things that they don't have to. But unfortunately, this is just a fact of life, and it is part of becoming musculoskeletally mature. Before we end today's episode, I wanted to leave you with these final questions. Is there any harm learning new skills sooner versus later? Can you get back to your previous level of activity without doing or trying anything different? Are there any disadvantages to learning something new? I hope that this was helpful. Please take it to heart if you can, and let me know if you have any other thoughts or questions. Thank you for listening to the Talking Rehab Podcast. I hope that this podcast stimulates you to question your own practice and how you approach rehabilitation. I truly appreciate your time and attention. If you enjoyed listening, make sure to like and subscribe to the podcast. I wish you a movement-filled day. Take care.